Good afternoon. You're listening to the WCEG network on WCEGTalkRadio.com, the worldwide community empowerment group. Like us on Facebook. Follow us on Twitter. Follow us on Instagram, or you can call in, Skype in. Join our conversation today. We are also live streaming on Facebook and on YouTube Live TV. Thank you for joining us today. I'm Myrna Taylor Ransom, your host for Your Good. And our guests today include Pettyjohn, who's a doctor at Morehouse School of Medicine, and Dr. Charles So, our regular doctor here on the show. Thank you for joining us.
Thank you, Myrna.
Thank you.
There are certain risk factors that can help prevent a stroke. We'll talk about that today. But did you know that there is a connection between stroke and lupus? There is an accelerated rate of stroke for patients with lupus. Today we'll start our discussion with defining what happens to the body when a person is having a stroke.
Yes. So when a person is having a stroke, it's almost like a heart attack in the brain. And so normally in a person's brain, you have good blood flow going. You can think of it like a water hose watering a garden. So the water is the blood, the water hose is the blood vessels. And what happens when someone is having a stroke, sometimes there is something that stops a good blood flow to the brain, or like with the water in the garden, the water doesn't flow to the garden like it's supposed to. This can happen if the water hose is squeezed, or it can happen if something gets stuck in the water hose or in the blood vessel. If that does happen, the cells in the brain that use the blood to get nutrients and oxygen, sometimes those are damaged or they can even die. And so if you can think of a water hose, and if you squeeze the water hose, you can see that not as much water goes to the garden, or same thing in the brain. If something gets stuck in the blood vessel in the brain, not enough blood goes to the cells. Yes.
So something happens to your internal irrigation system.
Yes, okay. That's correct.
That was a great analogy, the way you broke that down.
Mm-hmm.
But what you also have to understand that sometimes it's just not, it's always not enough blood, but look at the hose also can have a hole and start leaking because you have two types of stroke. You have stroke where you don't have enough blood, that is ischemic stroke, and you have the other one where you have a blood vessel that bursts. It's a hemorrhagic stroke.
So now the ischemic is not quite as serious sometimes, right?
All stroke are serious.
All strokes are serious. However, the ischemic, there's a much better recovery rate.
Yes, but all stroke are serious. Because if the reason why the all stroke are serious, because you have to go to the emergency, or to the hospital, or call 911 immediately. And most of the time, there is a delay of between the time of the stroke and the time when you get care.
And the recovery is better the quicker you get there, right?
Absolutely.
Correct.
Absolutely. Correct. If you have, we say there is a window of 3 hours between the time of the stroke and the time you should get care. If you pass those 3 hours window, sometimes we push it to 4. But if you pass those 3 hours, there was almost nothing to do, just except make sure that you get your blood pressure check, make sure that you are comfortable. But really, if you want to treat the stroke and increase your chances of recovery, you have to be in the hospital or to the emergency room within 3 hours of the stroke.
Now, when there is a gush of blood, is that what they call more connection with the atrial fibrillation?
Now, if you're speaking about the gush of blood being bleeding on the brain, that would not be the atrial fibrillation. With atrial fibrillation, that's when the heart isn't beating like it's supposed to. So instead of beating like boom, 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 boom. It's almost like it's kind of like shaking, and it's not getting that nice, good blood flow going through the heart. And so when your blood doesn't flow through the heart like it's supposed to, it can start to clot. And so if blood starts to clot, that blood clot can go up into a blood vessel in the brain, causing the ischemic stroke, or the one where there is a loss of blood flow without necessarily there being a bursting of a blood vessel or bleeding in the brain.
Well, what do you call it when you do have the bleeding in the brain?
A brain hemorrhage or a hemorrhagic stroke.
Okay. Is that more serious or more dangerous than an ischemic?
Yes, it's because it's you have blood that start bleeding. So sometimes, like I say, you might have you have a swollen brain, and if you have a swollen brain, the brain starts suffering, and sometimes you need to have emergency surgery, trying to stop the bleeding and also remove the clot, the blood clot there, which is the hemorrhage, and to decrease the swelling in that brain.
Let's talk about some of the risk factors.
So there's several risk factors that can cause someone to have a stroke. One of them being high blood pressure. So if your blood pressure is high, you can think of it again like the water hose. If you think, well, I want to water the garden, I'm gonna turn the water hose on a little bit, you get a little bit of blood flow to the garden. If you turn up that water very high, and if this isn't a good water hose, it can start to it can lead to one of the bleeding, the hemorrhagic strokes, or it can also cause damage to the blood vessels or the water hose, which can lead to plaque starting to build up inside the blood vessel. This can block blood flow to the brain that can cause the stroke. So high blood pressure is one. Another is high cholesterol. High cholesterol that can also add on the plaques in the blood vessels, which can also cause a lack of blood flow. Another medical condition is diabetes. Diabetes is another medical condition that can affect your blood vessels. And in a sense, similar damage to the blood vessels, which can either cause a clot to form or can also cause bleeding to occur as well. Those are some big
Those are the medical risk factors. Yeah. What about lifestyle risk factors?
I would say similarly that they could be related to those things. If you're eating high cholesterol foods, high fat foods, that can increase your cholesterol. If you're also eating an unhealthy lifestyle with a lot of sugar and carbohydrates, which can cause you to have diabetes, which can also increase your risk of having a stroke as well.
The other thing also is lack of exercise. We know that people that do not exercise, that have a sedentary life, has an increased risk of stroke. The other thing also we don't talk about is smoking. People that smoke have increased risk of having a stroke and heart attack. The other risk factor also is weight. So people that are overweight or obese have increased risk of stroke. Those are the risk factors that you as an individual can take action. There is other risk factors that
some uncontrollable risk factors as well, right?
Which is being African American, family history, and age. Because
age?
As we get older, we increase the risk of stroke. Though you cannot do nothing about those risk factors, but those are not the most important. The most important is the one that you can take control of, because you can take control of your blood pressure by taking your medicine and cutting back on the salt. You can decrease your cholesterol by eating more fruit and more vegetables. in taking your medicine against cholesterol is needed. You can prevent diabetes or control your diabetes if it's by diet, exercise, and taking your medicine. You can control your weight by cutting down on the calories and increasing your physical activities. You can fight against sedentary life by getting out of your couch and walk. So you see, all those things, you can really decrease your risk of stroke. I don't say you can eliminate 100%, but you can drastically decrease your risk of stroke and heart attack. Because I say a heart attack because stroke and heart attack are almost the same.
Just one happens in the heart and one
Yes,
happens.
happening to the brain.
Wow. I hadn't thought about that one. So, how would we know? What happens? How do you know if you're having a stroke?
So I'm not sure if anyone out there has heard or seen commercials or advertisement. There's a abbreviation, FAST, fast. And so this kind of explains some of the symptoms you might see in a person who may be having a stroke. The F, that stands for the face. Sometimes a part of the face can kind of droop down or it's kind of lower than the other side. It can be twisted. That could be one symptom that you may see if you've seen someone with a face like that. Some other ones, A, arm. It speaks about whether there's a weakness or numbness in one arm over the other. Sometimes people, they lose their ability to move that arm. That's possible. S stands for speech. Is that person having trouble speaking? Sometimes because the mouth is drooping, it can sound like they're slurring their words. Sometimes a person may start speaking gibberish. You can't even understand what they're saying.
Right.
That could be a sign of a stroke as well.
Or water, if you're drinking water or juice or something, it starts running out of the mouth.
Yeah, spilling out of the mouth. You're not able to hold in liquids or foods. And then T, that just speaks about the time, how important it is to, if you notice these symptoms in a person, try to get that person in to see a medical physician, preferably the emergency room, so that they can be treated for these symptoms.
Okay.
Just to say about the emergency room, you need to know which emergency room you're going.
Because
the reason why I say that is because not all emergency rooms are equipped to treat stroke. So you need to go to emergency room that have a stroke center where they can really immediately can take care of you. Because if some emergency room are not equipped,
now you're asking too much. Now if I'm having a stroke, I've got to remember
if you call 911, so the ambulance should know where to get you, because they can do a quick evaluation and take you to the right emergency room. If it's a family member taking you, if you don't know where to go and you're close to downtown, go to Grady.
Yeah, okay. Or just inquire. You can ask. But usually, if the paramedics know you're having a stroke, they should figure that out once they get there. Then they should know which emergency room would be best suited for you in that situation. Okay, so now we've gone through the FAST in terms of how we recognize a stroke. From examining the face or looking at the face, seeing differences in the face, noticing something in your arm, some kind of pain, weakness in the arm, noticing a slurred speech.
Any change in your speech.
Any change in your speech.
Even a change in your vision. If you have a sudden change in your vision, it might be a stroke.
Okay.
Question would be, did we go over heat stroke already? So they'll know
no. Which is a kind of different, because heat stroke, you are right now.
We know, out there.
Out there.
Yeah. Chances are right now in hot Atlanta,
playing football,
you could have a heat stroke because it's 90, 90,
95. It's going to be 95? Like 97 this weekend. And I know a lot of people are going to be out,
Yes.
and it's so easy to creep up on you because you're in the heat for over 30 minutes. Well, I say 15, 20
Yeah.
minutes. You're out there, and don't take long. Out there,
Yes.
you just you're hot, and especially for the little people, children, and the elderly. It is
Yeah.
going to be at the barbecue. You got to pay attention to them because it's so easy.
Yes,
It happens
absolutely.
so easy.
So why do some people recover with no symptoms or very little noticeable symptoms from the stroke, and then some people have the paralysis, and what happens?
So that all depends on the kind of stroke that they have. And so some people, what you're kind of getting at is what we call, if you ever heard the term mini stroke, some people will call it mini stroke. We call it a transient ischemic attack. So meaning like a short period of time where this person is experiencing these symptoms. And that can come if there is truly a blood clot that has gone into a blood vessel that may have gotten stuck for a little amount of time, and then some time passes and that clot gets dislodged or it comes away. And so the blood returns to the area that was affected. So in this case, what we look for is, okay, person comes in with these symptoms, they get better over time, and then when we do some of our images like CAT scan of the brain, we don't see any damage in the brain. And so the amount of time that this blood clot was there wasn't enough to cause permanent brain damage. And other people who come away and still have the weakness for the rest of their life, or for a longer for a longer period of time, or for the rest of their life, these are people whose strokes they can be either larger, it could stay for a much longer time, causing the permanent brain damage. The blood cells the brain cells in the brain was away from oxygen and nutrients too long to where they couldn't come back and recover. And so that's where you can kind of see some of the permanent weakness that can come along with some of those people.
Is there any way to prevent the permanent damage?
So that depends on, again, how quickly the person can get to the hospital. So if you see these symptoms, and this does happen to be one of those strokes where the blood clot isn't going to dislodge by itself, if you can get through to the emergency room in time within those 3 hours or so, we can give special kinds of medications for that period of time. Or if we see that medication can't be used for someone who's at risk of bleeding because it is a blood thinner or breaks up clots, we can have special doctors go in with special tools to actually physically get rid of that blood clot. But if they're away outside of that period of time, they would not likely benefit from those kinds of medications and treatments.
What are some of the other post-stroke symptoms?
Sometimes I think, you have all the physical things, but then some people who have stroke, they're at increased risk of depression. And so it's important to, as a doctor, if you know a person has had a stroke and you start seeing some of these symptoms, the person doesn't want to do things that they used to like to do, or they're sleeping more or can't sleep, some of those kinds of things, it's important for us to ask questions and try to make sure that this person isn't suffering from something else like depression as well as a result of having a stroke.
And the other consequence of stroke, if you can have, is sometimes dementia. People have what we call vascular dementia. Those because they have this stroke, and they have damage to the brain, and that can cause dementia also.
Dysphagia?
Dementia.
Dementia.
Dementia is like Alzheimer.
Right. What about the dysphagia?
Yeah, the dysphagia, usually when they have the stroke, it's a possibility that you have dysphagia and you're unable to swallow. That's why we call speech therapy, really to kind of teach you how to swallow. And they teach you how to swallow, they teach you how to talk again. in physical therapy is part of the treatment of stroke, and it has to be started immediately, as quick as possible, because you want to get back just your strengths. You need to get back your speech, and you need to get back be able to swallow.
I was also looking at some of the research, and it talked about incontinence as one of the symptoms post-stroke.
So anytime there is damage to the brain, it can affect. So the brain controls
Yes.
pretty much the entire
Everything.
body.
Yes.
And so if you happen to have the stroke in the area that's responsible for some of the muscles that control the bladder, or even your own voluntary, meaning you tell your body when to release to go use the bathroom. If any of those areas are affected in the brain, that could easily make it so you lose control of your own bladder and your own functions associated with those.
Yeah, because it depends the area of the brain that is affected.
And some parts control the
Yes.
speech, and
Some part control the speech, some part control the vision, some parts control your swallowing, some part control your upper extremity, some part control your lower extremity. So it all depend on where you're affected. So all the symptoms are due to the fact those part of the brains are affected.
now some of those lifestyle changes then post-stroke has to do with sexuality.
Yes.
Okay, is there an uncertainty there?
No. What I'm trying to say, you can have erectile dysfunction after a stroke. Not you. That's how I call what I was trying to understand. What do you call bisexuality?
Well, no, I was
Male or
talking
female?
about
You
no,
meant
no,
sexual encounters.
Libido and
libido.
yes.
Yeah.
Okay. Yes. Absolutely. Yes.
So there will be an increased or a decreased amount of libido.
Most of the time, it's a decrease of because also when you have your erection that is affected, that can decrease your libido also.
Okay. So in most cases it
Yes.
would be a reduced
Yes.
libido. But let's talk about sexuality. Now, you said bisexuality might...
No. I was trying to understand your question.
Oh, okay. Okay, I got you now. But so it would not affect your sexuality.
Yes, I do identify yourself.
There would be no change there.
I don't think so. Not to
You
my
don't think so?
knowledge. No.
All right. So with that, we do understand that there are a lot of post-stroke symptoms that can occur, and mentally, your depression
Yeah,
and
because if
cognition.
I am a person that is totally independent, and this is a acute event. It happened just instantly, and I was driving my car. I was going to everywhere I wanted to go. I was reading books. I was having a normal life, and suddenly I cannot do all these things. Definitely I will be affected. I will be affected mentally. I will be affected physically. Probably the energy that I have to get up every day and ride my bike, I won't have it anymore. I will probably lose some, I would say, the taste of life, because it's a drastic change.
Yeah. And it can be quite depressing
Yes,
to
absolutely.
have experienced this kind of
You
loss of
have-
activity.
You have to screen them for depression, and treat them for depression if necessary.
What about rehabilitation?
Yeah, that's part of the treatment. That's it's extremely important to start physical therapy, occupational therapy immediately after a stroke, because the earlier you start, the better it is. You have more chances of recovery if you start early than if you start late. If you start late, probably it's going to be really tough to have any recovery. And most of the time, we say after 2 years of intensive physical therapy, what you were able to recover, that's probably that you won't recover more than that.
Are there different types of stroke treatments?
Yes. What we spoke about earlier, there's, if you get there in time, there's the one medication we can give into the blood vessels that break down blood clots. There's the physical, actually going in with a tool and taking the blood clot out. In cases where these people come in outside of that window, what we can give is aspirin. So aspirin is very important to give as well. And that works in a little different than the blood clot breaking down. That kind of tries to keep blood clots from forming, or it tries to keep your platelets. Those are what make blood clots. It tries to keep them from all coming together and creating other blood clots. So it's more of something to try to prevent further strokes, but it could also help to any blood clot that might be there. Can kind of try to help break that down, but just not as good as some of the other medicines if they get there in time. And then doing things like making sure they're getting plenty of fluids throughout trying to get the blood running well, trying to get good blood flow to as much of the brain as possible. Because we don't want if the person comes in and they're dehydrated, there's not enough fluid running through their blood in the first place, that's not going to help them in the long run. So other things like that.
So preventing another stroke is possible.
Yes. Decreasing the chance of having another one. Yes.
Right. So, but it involves a whole lot of lifestyle changes.
Yes.
It's what we say earlier. The first thing that you have to do to avoid stroke, we talk about blood pressure, cholesterol, we talk about diabetes. So if you already have a stroke, you need to make sure that, first of all, if you have a very elevated blood pressure during the stroke, we try to decrease your blood pressure, but not too fast, because if we decrease it too fast, you don't have enough blood flow to your brain. So we decrease your blood pressure very progressively over the time, but we want at the end to have a normal blood pressure. Okay, we want you to take cholesterol medicine to prevent the plaques into your brain, into the vessel in your brain. We need to, if you have diabetes, you need to make sure your blood sugar is well controlled. Your A1C, what we call the hemoglobin A1C, which is your average of blood sugar for the past 3 to 4 months. It's a number. You want that number to be well controlled. You want to eat healthy, of course. You want you to exercise. You want you to eat healthy. What else? All the things that we said earlier, you need to do it. The other things also, we put you on aspirin. Say take aspirin, like Dr. Pettyjohn say earlier, because it's an anti-platelets.
Keeps the blood flowing.
Keep the blood flowing. And we give also some medication to help the aspirin too, that some type of, they're not anticoagulant, but they're antithrombotic, help keep your blood flowing into your brain vessels.
And what happens about your sleep? What is the occurrence that happens after a stroke about sleep? Do you sleep a lot? Do you sleep a lot less?
It all depends. If people that have a massive stroke will be sleeping because they have a massive stroke, and they have, it's not they sleeping, but they have what we call the altered mental status. But if you have after a stroke, if you're depressed, you might not be sleeping well. So it all depends. You can be either not sleeping enough, or sleeping too much, or sometimes no effects on your sleep.
And the memory, sometimes you have an increased memory of things from the past, but you can't really remember. Your short-term memory is really affected.
What we call, it's not you have an increased memory. It doesn't happen that way. You can have a decrease of your memory. That's what we call that's what we say a dementia, early after a stroke. People that have a stroke can have they're most prone to some type of, it's not Alzheimer by itself because Alzheimer is a different process,
Right.
but it's what we call it vascular dementia. By not enough oxygenation and blood supply to the brain, and that creates the loss of memory. The loss of memory can be long term, it can be short term. Usually, what we lose most of the time is the first thing that we lose is the short term memory. People remember things that happened a long time ago.
Long time ago.
Yes.
And detailed
In
memory.
detail, yeah. But the short-term memory, most of the time, is the memory that we lose first, than the long-term
You
memory.
don't really have to have a stroke to lose that short-term memory. Just saying.
Personally speaking, right?
Yeah. And I want to ask while we're on stroke, I noticed, besides my son, when he was 10, I noticed other kids came in with Bell palsy, with they, was in that family of stroke, because, like,
It looks like a
Bell
stroke.
palsy is not a stroke by
No,
itself.
but it looks like a
It's
stroke.
linked to a virus. It's you have your eyes has difficulty to close it, and you have a kind of paralysis on your face
on one side.
on one side. And we use antiviral therapy and steroid to treat Bell palsy, but it's totally different from a stroke.
It is not a
Correct.
stroke,
Yeah, it is
although it
not.
looks like a
Yeah,
stroke.
it is
Right.
not a stroke.
Right. And I just wanted to bring that up because I was listening to your symptoms, and the symptoms was looking the same.
Yeah, if you don't know what it is, just call 911, go to emergency room, get evaluated. It's better because if you lose a 3 hours window, your prognosis, you have a better prognosis, a better recovery, if you come within those 3 hours.
So with Bell's palsy is not related
No,
to stroke.
No.
Okay, well that's a
It just
relief.
appear that way.
Yeah, that's a relief. When we talk about lupus, and we're going to switch gears a little bit now, what are we talking about with this disease? And then we're going to connect it to stroke, but not right now.
So lupus is what we call an autoimmune disease. So normally our bodies have certain kinds of cells that fight off infections. And so sometimes when these same cells, something happens to them and they start fighting some of our own cells instead of the infections that come into our body. When things like that happen, you can have different autoimmune diseases, one of which is lupus. And so these cells that are supposed to be fighting these infections start fighting some of our own cells, or there are these other kinds of tools that our cells use called antibodies that start attacking or signaling our normal body cells to start attacking certain parts of our body. So lupus is a result of one of those kinds of processes, or one of those kinds of things.
Now that's a disease that really throws people for a loop because it's sometimes not just unrecognizable, but it takes a long time to come up with that prognosis.
It can sometimes. Sometimes we look for other reasons for the person's symptoms, and sometimes we aren't able to find things, or sometimes we are able to find things. Sometimes if we're thinking about this as being a cause of this person's symptoms, we can do a test, a blood test that will allow us to see if there's any what we call antibodies, these proteins in our blood that are against some of our own cells. And so when we go and we find this, we can say, okay, well, we might need to look a little further to see if there's something else that's going on.
How would a person recognize having symptoms of lupus?
So it's There are many symptoms that a person may have. One of which, some of the more recognizable ones, or ones that many people would have an idea about, is a rash that's on the nose and kind of on your cheeks. We kind of describe it like a butterfly rash because it kind of looks like that. The rash is kind of, can be a little darker than your regular skin. It can be kind of dry and it'll go across your cheeks.
Kind of
it
like
can
a
kind of come
birthmark?
down.
But more pronounced than a birthmark.
I guess it depends on what kind of birthmark you're used to seeing. Some birthmarks are lighter, some birthmarks are darker.
He's talking more shape.
Yeah, so
I have a butterfly, but I don't think it's nothing more than a birthmark.
But mostly it's on your face for.
But it's not on my face.
Yes.
and then a person, they can have some other things that could go along with many other diagnoses. They can have some joint aches or pains. You can have some changes in your hair. You can lose.
What kind of changes?
So you can
Losing?
lose your
lose
hair. You can feel tired all the time.
And acid, chest wise. Some people have problems with, reflux acid.
Acid reflux.
It's so many. It's fatigue.
Yes.
If you have some fever, they just feel
Low grade.
Yeah, low grade fever. It's not just like a fever from big bad infection, but just some low grade fever that is hanging there, doesn't want to go anywhere, not feeling well, depressed. You have all those symptoms that comes with lupus. There is nothing specific to lupus, maybe the rash, but most of these symptoms they hear, but you as a physician, you have to think about it because you have to also to understand that it affects mostly female more than male, and unfortunately it affects more African American than the other race.
And Dr. So, if I could add, sometimes it's diagnosed as arthritis because patients don't actually know how to explain to the doctor what they're actually feeling and or they'll forget to tell them about the other things that they're going through. They just tell them what's hurting at that moment. They think the smaller things are not as important. Well, they had to buy some cream and try to get something off their face or whatever, and they forget to mention that part to the doctor. The butterfly we was talking about.
Now, there are certain medications that can also cause lupus.
Yes, some medication can cause some type of lupus. There is some blood pressure medicine. I believe it's hydralazine. In some of the but if you stop those, you have to know it. If you stop the medicine, the symptoms disappear. But the other type of lupus that is not related to medication, your symptoms will still be here.
Now, there are also some type of toxins in the air that cigarette smoke can also cause it or trigger it.
It's a possibility. I'm not 100% sure, but it's a possibility. I believe that cigarette and smoking and those fume can trigger too many diseases.
Can trigger
from
just
heart
about
attack,
anything,
from
right?
stroke, from asthma, from COPD.
Just a myriad
Yes.
of different infections and diseases.
Yeah.
So the take home from that is, if
We
you
need a
smoke,
smoke-free environment
stop,
anyway.
quit. If you don't start, fine.
Yeah.
You have an increased chance of
Yeah.
surviving some of these or preventing some of these drastic diseases. Yeah. So now, but there is a connection between lupus and stroke.
Yes, you are at increased risk of stroke. Sorry, if you have lupus, you are increased risk of stroke. It's an inflammatory disease. In all inflammatory disease, there is an inflammation. And anytime there's inflammation, you increase risk of stroke. You increase risk of having damage to your arteries, to your joints, and you have increased risk of stroke and heart attack. And that's almost for all inflammatory disease, and lupus is one of them.
And stressful events in a person's
Yes.
life can also trigger lupus.
Absolutely, absolutely. Stress can,
Death in the family, divorce,
yes,
That's stressful.
and yes, stress
Fatigue.
definitely can trigger lupus.
serious injury,
Yes,
any of those kinds of
Trauma.
traumatic
yes,
events can
Absolutely,
trigger
yes.
lupus. Childbirth, wow.
That's trauma.
let's don't. I rather call it not trauma. I call it a joy.
Okay. Joyful trauma.
Count everything as joy.
Yes.
That one.
Yes. But also, people who actually have lupus question, do they get cold faster? Because it seems like they have more anemic. They're more anemic than others
Yes,
because of their
they-
fingertips and
Part of the lupus is anemia too. Is one of the symptoms, and also, like I say, you have your decrease of your immunity. Your white cells also can go down with lupus, so you're more prone to infection also. So this is all part of the inflammatory process.
But every
Like I
day,
say, it affect almost your entire body. Yes, we didn't talk about it, it still affect the kidney, because you have people that are on dialysis not because they have diabetes, but they have lupus, so it can affect your kidney. And the way we look at lupus, any effect, you can have rash. We talk about the rash on your face, but you can have those rash in your legs, chest, and everywhere, arms. One thing we have to remember, lupus, you don't have two identical lupus. Some will have mostly renal problem, other will have cardiac problem, other will have joint issues. It all depends. Those is the skin. It all depends how your lupus manifests. And it change drastically from one individual to another one.
but everyday stresses. The research was saying traffic, a bad relationship. Any of these things can trigger
Yes.
lupus.
Yes.
Now that seems a little
I mean,
Far-fetched.
Even heart attack, if you have trauma or increased stress, it can give you a heart attack. But like I said, again, stress can be responsible of early death in life. So we, as individual, should know how to manage stress, because it's all events in life are stressful, almost.
right. So
Just
then
driving
we must
the traffic.
learn.
So you have to do some meditation, some prayers, some deep breathing, reading.
exercise.
Because life itself is stressful.
Yes.
So
It is.
you really have to, it depends on your perspective. You have to really take things with a grain of
Yes.
salt, and don't try not to let things upset
Yeah.
you so much, because it can kill you.
Absolutely. And we have to know how to manage stress.
And a lot of that has to do with mental state, physical working out. Because a lot of times when you exercise, you burn off a lot of the stress of life, and that's a good thing. At least you have a way of balancing it out and getting it off.
Yes, absolutely. Because we talked earlier about eating healthy. Just the fact to eat healthy decrease your stress. I strongly believe that people that eat plenty of fruit, plenty of vegetables, have less stress than people that spend their time eating red meat. I don't have the facts, but I'm pretty sure about it. Because his goal was a lifestyle.
Right.
People that pray, believe in God, have less stress than people that don't believe in God, because we know
is
that we
true.
cannot solve all the problems, and you have some problems you have to give it to let God take care of it. Let it go.
And let God. That's the saying. that could help tremendously, because you know that all things work together for your good.
Yes.
You know, so
Absolutely.
sometimes you just have to toss it up and
Yeah.
and
And
And keep it moving.
And if you have a failure somewhere, you say, you know what, probably that was a good thing for me.
right.
Yeah,
Yeah,
take it
because
on
you
the-
don't really know
Yeah.
whether it was the best thing for your life. So if it didn't happen, 9 times out of 10, it's not for you.
Yeah, if you didn't get the job, don't worry about it.
Yeah, there's another one coming, a better one.
Also,
A better one.
it just decrease your stress too.
Yes.
Right.
That
Because
job
that
could've been
job could
stressful.
kill you. So we have to be careful what we ask for.
Yes, because we don't know what we really want.
Right. Okay, we're going to take a short break here. Thank you for joining us. We also have with us our traveling nurse, Pam Davis, who's here with us today. We have from the Morehouse School of Medicine, Doctors Aaron Pettyjohn and Charles. So I always want to call you Pettigrew, but Pettyjohn.
I've heard a number of different things. I've heard petticoat and Little John
yeah,
and all
that's a
kinds
good
of
one.
things.
Yeah. And we will be back in a little bit. We're going to take a short break and we'll continue our discussion on stroke and lupus together.